family trip to Mexico has left a local couple with more than $400,000 in medical debt after a wife and a mother contracted a rare illness that nearly killed her.
Yeah, On Your Side's Christine Lazar joins us now to explain why her health insurance didn't cover a dime of her treatment and how the same thing could happen to you. This is a scary thing.
Well, you know, whenever I travel abroad, which is not all that often, but when I do, I always call my cell phone carrier and say, I just want to make sure that I'm covered. Do I need to buy anything extra? But how often do we call our insurer?
Never.
I have never done it.
Never.
And that's a much more costly issue than it would be if you had roaming charges, right? And this family learned that the hard way. So U.S. health insurance plans and Medicare typically don't cover routine or even emergency care once you leave the country. But many don't find this out until it's too late.
You're a free woman.
Paloma Roel was overcome with emotion as she left a hospital in Mexico City. After months of care and several life-saving surgeries, including an organ transplant, the married mother of a teenage daughter contracted a rare strain of hepatitis A while visiting her extended family in Mazatlan, Mexico, as they do every summer.
Her liver was at 95% failure, not recoverable. It was critical she gets a liver transplant. And on top of that, because of her liver failure, her kidney was excreting high levels of ammonia, which was causing swelling in the brain and ran the risk of both permanent damage to the brain, as well as potentially ending up in a situation where she would become potentially brain dead.
Paloma's husband, Doug Roel, says her health declined so fast by the time they realized she needed emergency care, she was too sick for a medical transport back to the U.S.
But now we're obviously, as a family that's based in Los Angeles, we're here in Mexico City for the foreseeable future. This is a 6 to 9 month recovery with 24/7 nursing. You're doing so good.
And while Roel says his wife has received good medical care, it's come at a price. The family's health insurance plan, a PPO, does not cover any of Paloma's care because she got sick outside of the U.S.
How much have you paid so far in her medical care?
I would say it's been between 8 million to 10 million in Mexican pesos so far. That roughly translates to somewhere north of $500,000 out of pocket.
The family has had to liquidate retirement funds, savings accounts, and rely on the generosity of friends and family.
We were left in a situation where we were in a life and death moment, and we had to choose, how do we save, my wife and my daughter's mother?
And unlike here in the U.S., most payments for health care in Mexico are required up front.
You have to be prepared to pay a retainer, pay along the way, and then before you can exit the hospital, settle the bill.
I think most travelers are unaware of the fact that their health insurance may not cover them.
Diane Burlingame is a travel advisor who's been in the industry for decades. She says typical comprehensive travel insurance will run you about 5 to 7% of the total trip cost. A bundled policy usually covers cancellations, delays, and health care abroad.
I think there's a feeling, I've already spent so much on my vacation. Why do I need to get this insurance? We're not going to cancel. I'm healthy. Yeah. What do you say to that?
Well, famous last words. Insurance is one of those things we all buy and then we hope we never use. So it's a little counterintuitive, but it's a relatively small amount to pay if and when something happens.
As for Paloma, she and her husband will have to remain in Mexico for another 4 to 6 months until she's stable enough to travel home. Their teenage daughter is now back in the States with family.
And that's been my strength, is this has to happen. My wife has to make it back home to us, and our family's got to be reunited. And whatever that takes, I'm going to do.
But let this be a lesson to others.
Yes.
It is important to note that some insurance plans will not cover emergency care even when you're still in the U.S. but traveling out of state. So before you take your next trip, take the time to make a call and know your coverage. And of course, look into travel insurance. I know people are like, I'm already spending a lot of money. I don't want to get it. But I will say personally, we were in Hawaii once and one of my family members got very sick and he needed to be hospitalized. Thankfully, we had bought an insurance policy, which covered not only, you know, some of his care, but also being able to stay in the hotel for longer. Because this family is also now paying for lodging. They don't live in Mexico. And she's got a long road ahead. She's out of the hospital, but she's in like 24-hour care. And it's 4 to 6 months till she's healthy enough to come back. So that's going to just keep adding up, and it's all going to have to be out of pocket.
This is one of those stories. I'm so grateful that you bring it to us because I think it's eye-opening to so many people.
I never would have thought about this, and we wish her well on her recovery.
And I'm grateful for them to coming to us. You know, it's done for them. There's no help for them, right? But they just want others to help other people land in the same position.
Yes, we thank them too. Thank you, Christine.